I would like to introduce today's presenters. We have myself, Kevin Cannon, Senior Director of Safety and Health Services at Agency of America. Howard Mavity, Partner, Atlanta, Fisher Phillips. Howard Mavity is a partner in the firm's Atlanta office. He is a member of the firm's COVID-19 task force, a cross-disciplinary team of attorneys dedicated to advising employers on the many workplace law aspects of the global coronavirus pandemic. We have William Powell, Regional Safety Manager for Donnelly's, Inc. Bill joined Donnelly's in 2011 and is responsible for the administration of their corporate safety program. Rocky Roulette, Vice President of Safety, Faith Technologies. Rocky began his career with Faith Technologies in 2014 and manages the company safety program. Dale Dogie, Vice President, Risk Control, Willis Towers Watson. Dale Dogie joined Willis Towers Watson in 2013 with over 25 years of safety and construction experience. He is currently the Vice President of Risk Control of Willis Towers Watson. And we also have joining us today, Steve Sander, who is the CEO of Agency of America. Gentlemen, thank you for all being with us today, and I'll go ahead and kick things off. Here's a lineup of the speakers that I just mentioned. And today's outline will have industry obligations delivered by Steve, regulatory update delivered by myself, legal aspects by Howard, and then we'll have the GC perspective from Bill Powell and the subcontractors perspective from Rocky Roulette, and then we'll end the presentation with industry practices by Dale Dogie. And with that, here's the message from Agency of America CEO.
Thank you, Kevin, and thank you to the panelists for participating in today's webinar. It need not be a reminder to everyone that safety is the primary concern of every construction project, and that is axiomatic regardless of whether or not there is a virus present. And one of the reasons that we have been able to get government authorities at all levels to recognize that construction, for the most part, is an essential industry and the construction operations need to continue, is they've relied on communications sent by Agency of America and by our chapters that make clear that construction sites are practicing social distancing, using PPE, and monitoring individuals who enter our job sites, which creates a safer environment than exists in other industries. And for the most part, construction unions support continued work if safety practices are maintained. Next slide, please. Go back, please, Kevin. Okay, having said that, we are perfectly aware that government officials can reverse the ability to continue to operate with the stroke of a pen. And we are getting messages from around the country of government officials that are taking a second look at whether construction is an essential industry and our operations should continue. And I think we all need to be aware that there are a lot of idle people sitting at home, sitting in apartment buildings with nothing else to do. And if there's a construction site nearby, that they have a phone with a camera, and that every private citizen has the potential to be a public inspector. And if they see construction sites where PPE is not being worn, where there are clusters of workers for prolonged periods of time not practicing social distancing, they're likely to photograph that or video it and share it on social media or, in fact, with government agencies. And so we really are encouraging construction CEOs and senior executives to take an extra step to ensure that safe practices are known, understood, and followed. And obviously, we have the resources to assist in that effort, and they will be shared in this webinar. The public is counting on us to do our part to prevent the spread of COVID-19. And I should also note that at 2 o'clock Eastern Time, we sent a message to every AGC member firm reminding them of their obligations to maintain safe practices so that construction operations can continue that we can continue to keep our job sites open while maintaining safe practices at those sites. So with that message, I'd like to turn it over to our panelists and look forward to their presentations. Thanks very much, everyone.
Thank you, Steve. So in the outline, it was highlighted that we're going to talk about, how DOL OSHA is responding to COVID-19. One of the things that they did initially was to, create a safety and health topics page on COVID-19. And on that page, it has links to their relevant standards, such as PPE standard, sanitation standard, ventilation standard, but they also link to a lot of the guidance that most have been relying on from the CDC, as well as the World Health Organization. On that page, you'll also see that they have issued some guidance on recording workplace exposures to COVID-19. One of the things that we'd like to highlight is that it must meet the 3 criteria. 1, it is a confirmed case. 2, it's work-related. And 3, it meets the general recording criteria, which is medical treatment beyond first aid, loss of consciousness, days away from work, and so on. But one thing that we did is early on when this was initially put out was have a conversation with the Secretary of Labor. Actually, Steve had a one-on-one phone call with him just to express our concerns based on the fact that these cases, the difficulty in determining whether there's work-relatedness to anyone who's contracted the virus can be impossible, if not difficult. And we put together some guidance for our members, and one of the key pieces in that document is this paragraph or this few sentences. Work-relatedness is presumed for injuries and illnesses resulting from events or exposures occurring in the work environment, unless an exception to 1904 5B2 specifically applies. A case is presumed work-related if and only if an event or exposure in the work environment is discernible cause of the injury or illness, or a significant aggravation to a pre-existing condition. And so basically, if an employee's condition arose outside the work environment and there was no discernible event or exposure that led to the condition, the presumption of work relationship does not apply. And I think that's key here is to keep in mind that you'll have to go through your process of investigating, asking the appropriate questions of the individual to determine whether or not that exposure occurred in your work site. And I think the short of it is just not to presume any case that's reported to you on the job site is caused by the work itself. AGC is also engaged in efforts to help construction with the COVID-19 virus. One of our initial concerns was how we as an association were going to assist our members with protecting their employees, but also how the federal government would also respond, in this case, OSHA. So we created a page dedicated solely to COVID-19. And on the page, it has some of the background info. Again, we cite CDC and WHO as far as what the symptoms are, what is COVID-19. There are tips for employers, what you should educate your employees on, planning considerations, And then one of the things that we had been hearing from a lot of our members was, not a lot of this, what was already out there as far as guidance is concerned, was specific to the construction industry. So AGC, along with its chapters, have created a wealth of resources on the page, and they include recommended practice for construction job sites, how to shut down the project, how to start up the project, and we're also working on guidelines for responding to a suspected or confirmed case in the workplace, and we'll add more resources as they become available. One of the things that we hope to get out soon is for lack of better terms, an infectious disease plan, identification, response, and action plan. So we should have that up here pretty soon. So please visit the website. If you go to agc.org, it is the static tile that's up there right now, and I think you'll find it to be very useful. Howard?
Well, good afternoon, everybody. I've lost track of how many webinars I've done on this topic because the issues are changing every day. I think the first 5 or 6 I did, I would have a slide that said last week's issues or yesterday's issues and what we're looking at now. And as Kevin rightly said, things are going to change both factually and legally. I do want to emphasize a point both he and Steve made, which is important on a legal level also, is that we have to be incredibly protective of our image as employers for a lot of very, very practical reasons. One I list at the bottom of this slide is that employees and unions will have long memories about those of us who do not take care of, communicate effectively with, and protect our workers, particularly if we begin to see some of the worst possible outcomes as we go along. In the short run, though, I'm very sensitive to the issue about if we look bad and there are a lot of complaints about the industry, our essential business status could become rather wobbly because there is no centralization of this. I'm on 2 task forces now because ever since SARS, I've run our firm's loosely aligned pandemic response and task force. Now we have a second one I'm on, which is our essential business task force. I would say between our COVID-19 and our essential business, about 150, 200 of our 430 odd lawyers are involved. There are differences in many of the city, county, and state orders. They often allude to or actively follow the DHS guidelines, but there are quirks in many of them. And right now, we're seeing minimal challenges by law enforcement and health departments of employees traveling to work. We work with clients and they prepare a letter that explains that they are essential employees with an essential business entity, but that could well change. And I listed several examples of just how press and human nature could affect us. I have great respect for the governor of Ohio, Mike DeWine. I understand young people are wearing hats and T-shirts and gathering to list his nightly speeches and call it having wine with DeWine. But I noticed a couple of days ago, he was already tweeting saying, look, there's a business violation of rules, let us know. Many of the state health departments and other governmental sites now have procedures to report people who are violating, the essential business and shelter requirements. On a far lesser extent, we're seeing some unions and third-party organizations challenge this. But on a practical level, and this is really of more concern to me, we're strictly a management labor firm. We only represent businesses. We do not represent individual employees because we'd pretty soon be conflicted out of all our clients. But we are getting dozens, maybe hundreds of calls from people that we can't help and tell them that. But most of their questions are, I can't believe my boss is calling me in, I'm not essential, or it's not safe, or they're not giving us adequate training in PPE, they're not communicating with us, we're going to see an acceleration of this, and that is going to result in people not coming to work and complaining to OSHA and to other challenges. And that final one I listed in part for my own amusement. There's been some rather humorous pronouncements made by mayors around the country. If you have a chance, go online on YouTube and listen to the pronouncement by Walton County, Kentucky's mayor, and you'll just laugh your head off, though he's solid. But of course, I put down the LA one about the mayor yesterday, sort of pettishly in the morning said, we'll just start shutting off the water and power of businesses who break the rules. And he backed off that a little bit later, but I think it is worthy of taking serious. All right. There we go. I don't want us to have tunnel vision. My theory has always been that all business is risk management because decision-making always involves weighing risk, whether it be bidding for a project, acquisitions, or safety issues. And you can't manage risk management without being aware of related issues and related legal concerns. We're not going to go into today the Families First Coronavirus Recovery Act, FFCRA, we love acronyms, paid sick leave and emergency FAMLA provisions. But many contractors are never really worried about FAMLA because they may not have adequate number of employees who are covered because they work 12 months, 1,250 hours. That restriction has now been relaxed. On the paid sick, basically there is no delay in becoming eligible for it. There are more questions unanswered on this law right now than there are answered. But just as we are already having to weigh the Americans with Disabilities Act, state disability discrimination laws, even things like the different credit protection acts in California, we need to keep in mind that we do have fairly rapidly evolving changes in this area. It does not affect those businesses with 499, or does only affect those businesses with 499 and under employees. There are a lot of questions remaining, though, for companies that are made up of many divisions and corporations. Are they one entity, or are they separate entities that might fall underneath? We are very commonly seeing unions seeking responses from employers. And I've got a file about a quarter-inch thick of them. I was just perusing them a moment ago. And most of these are not adversarial. These basically are a union fulfilling its duty to represent its members and show that it took proper action. And they're asking for various types of responses, mainly on the extent to which businesses are following OSHA and CDC business protection recommendations. Although there are also communications getting in already into the effect of the new law on paid sick time, leave, and other areas. And then we've got, frankly, a real rise, acceleration, whatever you want to call it, in employees complaining to OSHA about their safety because of the COVID-19. And the reasons they're complaining are instructive about what we need to do, both simply to protect employees, but to minimize these sort of complaints. Most have arisen so far from non-routine tasks, employees being asked to do things that they would not normally do. In our setting, and we'll talk about this more in a moment, a good example would be if we have employees who are not medical, EMTs or on-site nurses or whatever, taking temperature of employees as they come to work. Concerned, are they given adequate PPE? Are they given the necessary training? Which frankly takes us to CDC and OSHA healthcare guidance. But we see a lot of employees saying, I don't normally do this. You early on saw federal employees filing whistleblower and safety complaints because they said they were plucked out of administrative roles and given the job of escorting infected passengers from cruise liners without really any training or adequate PPE. And that leads to the next one, where social distancing isn't enough, concerns about, we really don't have adequate PPE here. And then the final one is, well, we shouldn't be working or exposed at all right now. And I was talking with the group before we started. Everything we're doing right now is sort of a non-routine task, because we're trying as best we can to carry on normal business in a decidedly abnormal environment. And we need to have that mentality that employees will respond more about, I'm not adequately trained, that you're not doing enough, I'm concerned. And that is just a fact of life. And on these, I shouldn't be working, I shouldn't be exposed in the first place, that's a tough call. And let's talk a little bit about how OSHA looks at that, and then kind of practical world application. OSHA, pretty much without exception, protects employees' right to complain or bring up safety concerns. And it's been my experience our members respect that, which is very important, because one of the things OSHA looks at when they do review this sort of scenario is, have we aggressively made sure employees know that we're not joking, wink, wink, nod, nod. They really should come and raise concerns with us. But with regard to refusing an assignment, refusing to travel, things like that, it's a little bit different standard. In fact, it's a lot different. OSHA's approach, and most related laws in the various states, there are exceptions, but generally the approach is, would a reasonable person in that setting deem this to be a hazard? Would it, something they deem to be a hazard such that they could not safely work around it? Had they gone through complaining and seeking some change by their employer? And this is, anytime you guys know from a lot of areas of law, and we talk about a reasonable person, well, that person doesn't exist that I've ever seen. So we start looking at basically, what does the industry think? What are the practices in the industry? What do the CDC and other public health authorities say about our industry? And as Kevin mentioned, there has not been as much focus on construction, in part because there is an assumption when you're out working on excavation and site work, or before, you're putting up walls and such, you're wide open, separated, et cetera, et cetera. So it can be, as our situation worsens, important to really think through, is it reasonable for this person to refuse to come to work, refuse these tasks? Go through it and don't make a knee-jerk decision. Make sure you've documented that you've talked to the person, you've investigated alternatives, you've made sure they have adequate training, PPE, et cetera, as required, done everything you can to address their concerns. And if you can't, they just flatly refuse to work, then you're probably legit on your termination. The key thing is, don't do a knee-jerk action. Be able to pull up your internal emails or whatever and show you went through these steps, you talked to them, you tried to make sure that you were addressing all the concerns, you finally had no choice. And as the situation gets worse, it'll get more tricky. I've had these calls arise in healthcare, and again, we got to look at the standards of that industry of healthcare. But just as I said, all work is non-routine going forth. I don't mean to sound callous, but there's going to be an element of hazard for all of us every time we go outside. These are not easy calls, but it is largely, to the extent such a thing exists, a reasonable test. The best approach is to make sure employees know we're on top of it so that they don't make a complaint. And while I'm on this, I want to revisit an issue which had gone dormant. We had many, many calls early on about employees afraid to travel to China, to Japan, to Italy, and so forth. Then those obviously went away because international business travel all but went away. And we joked early on, before things got more serious, about, refusing to go to Little Rock or Hoboken or Allentown, Pennsylvania was not a a reasonable person would not find this to be a hazard. Well, fast forward to where we are now, and it might well be a hazard that would be unacceptable to have business people travel to some parts of the country. We are taking an approach right now that if a client comes to us and says, we just had an employee come back from New York City, given that by their own admission, they've got a very serious situation there, we're going to require this person to stay home for 14 days. Well, early on, we probably would have said no, not unless you have some indication they may have been exposed or were at a hotel with somebody who had the virus, et cetera, et cetera. But now that may well be justifiable because you can infect others while asymptomatic. So it might well, and often probably is legitimate to have them stay home the 14 days, just as they were doing, 4 weeks before for employees returning from China. This, of course, though, does mean that we have renewed travel issues. Many of the attendees on this have numerous people that are traveling, that are working on out-of-town sites or going as a tech to work at a customer site. We need to emphasize having our employees' site safety analysis, and when it's individual techs going to customer sites and all to do their very quick job safety analysis before they go on site for the particular task. And they need to consider the issues, any additional issues that may be presented by this virus, just as over the years we've had them consider fall, electrical, and other hazards. And you think about it, an interesting side issue on this is as we require additional PPE, we end up redoing training, job safety analysis, and all other aspects of it. And if we get to an OSHA citation point, OSHA is obviously going to be a little uncomfortable, as we'll say in a moment, about applying their general duty analysis, but they're absolutely able to apply rules about respiratory protection, PPE, and 19, 26, 20, and 21 about an employer's general duties, a construction employer that is, to protect their employees. So let's talk a little bit about the specific legal parameters that exist. All of us know painfully well from experience how hard it is to revise, update, or develop reasonable new OSHA standards. And as a result, more and more as business changes, OSHA has to fall back to a general duty clause analysis. Basically, this just says that under the 5A1 section of the Act, 5A2, excuse me, there was one, that the employer has an obligation to provide, general obligation to provide safety to employees. The way that breaks down, though, is OSHA has to look and see what does your industry view as a hazard? What do you as a company view as a hazard? What do your own evaluations, your own rules, your handbooks say? And then what does your industry think are appropriate responses to this? Well, you can imagine that lawyers have a heyday challenging that, where OSHA is trying to apply concepts that aren't vertical standards. Most of you know that you can't automatically apply a consensus standard and say, well, that's what applies if it hasn't expressly been adopted. And even where there is clear recognition of those consensus standards, such as combustible dust, OSHA may misapply the various consensus standards sometime, but pretty much all industries accept those are the guiding rules. So in this case, OSHA is going to look very much at CDC guidance. And if you read their actually pretty good guide, it's based, in many cases, word for word on CDC guidance. And I don't think any of us doubt that a general duty citation, 5A1, could be made out basing it on violations of this guidance. It would not be prescriptive. It's a process. But there's no doubt in our mind that as this progresses and OSHA gets its sea legs, we will see citations issued where employers are not, and the key is always documenting they did an analysis and are protecting their employees. Now, Kevin had raised this next issue. If you have looked in OSHA guidance and in a lot of public health guidance, you'll see there is an occupational risk pyramid, I believe on page 11 of the new OSHA guide, and it talks about very high exposure risk, high exposure risk, medium exposure risk, lower exposure risk, and obviously that guides your actions. We are in such a fluid situation. I think it will be difficult to prescriptively always apply that precise an analysis, but just as we apply this, in a PSM or a combustible dust setting, it can be applied. And to me, the key is that you document, you went through it, and you evaluated the different areas of risk and severity on your different jobs, because they obviously will vary. If you're at a point in a project where it's all inside and employees have to work in close proximity, that's obviously presents more risk and challenges than when we're doing the initial site work. If it is a multi-employer site and you're around a lot of crafts and a lot of subs, that increases your risk. If it's ongoing work and shutdown or ongoing work, maintenance, etc., in a operating factory, hospital, whatever, again, that affects your risk analysis. So I don't realistically expect all of you to have a document with categories very high, medium, lower exposure risk, but I do frankly expect you to document you have put some thought into analyzing your various jobs and determining riskier areas. And then, of course, I would take it a step further, and I would look at not only specific jobs, but what I call choke points. The other panelists are going to talk more about that, but when we start dealing with social separation, to analogize to another industry, it's hard to imagine a more hostile environment to a virus than the floor of a foundry where they're pouring molten metal, but they still may have to go through clocking in, donning and duffing in a break room or locker room, going to eat in the break room. In our case, a little bit different issues, things like various types of trailers and so forth on a job site. And I would consider these in my analysis and then in my responses. And I, again, with all we've got going on, am not worried about perfection. If OSHA, or frankly, if I were on your site and asking you, how did you decide which precautions to take, that you could actually say, well, we looked at this stage of the work and we're doing this, and we thought about that, we looked at our yard and our trailers and we thought about that, and document it. That is what I think you really need to do. The format of how you do it does not particularly worry me. Now, steps we can take to minimize risk of transmission, we're going to start getting into in a moment under that next bullet point. But I do want to say that I agree with Kevin with regard to the recordability issue. Whether it changes, OSHA refines, restricts, expands guidance, we'll just have to see. But we are adhering generally to a theory that there needs to be some sort of evidence of a causal link. It's certainly in a setting like construction, in a setting such as a healthcare or medical provider, there's going to be more of a presumption it occurred and was work related. Kevin, is there anything else you'd want to say on that, or anything you'd want me to say?
No, one thing I failed to cover during my session is that Monday we sent a letter over to OSHA requesting, either further clarification on the record keeping or, one of these three things. One, treat it as the cold or flu, whereas it would not be deemed work related. Two, only require those in the healthcare setting to maintain these illnesses on their log. Or three, allow contractors to maintain a separate log if, OSHA, BLS if they're interested in, collecting this data for whatever reason, allow contractors to maintain a separate log, whereas, these cases will not impact their overall injury illness rates.
Yeah, all of which seems reasonable to me. Stay tuned. Right now, we're trying to be fair. If there are facts that suggest it was exposure at work, then we suck it up. Now, as to reportability, we still got the issue of were they hospitalized, more than a night for treatment. And if they're hospitalized, it probably was for treatment, but you still always got the question, was it for treatment or was it for observation? Also, remember, there is an assumption that if the hospitalization in this setting didn't occur within 24 hours of the incident exposure, that's not generally reportable either. So it may change when we have more and more cases and you can more see, well, crap, we had so-and-so in the trailer who's now out with it, and we've had 5 other folks that routinely worked in that trailer that were exposed. We're probably going to find Ocean and say that's work-related, even though they could have gotten it in the normal course of just living. Now, talking about the recommendations, and I hope our other panelists will jump in on different twists they've got on this, but I'd first like to reference a document AGC prepared, and I think Kevin may have referenced it, and he will tell you this is not perfect, it is not magic, but it's pretty dang good. It is a pre-screening questionnaire among their proactive measures for addressing the virus, and this is completely and appropriately appropriate and lawful. If you are now going to a point where you have someone asking employees things like, have you traveled within the last 14 days to an area with known, and I would probably think more along the lines of heavy local or international spread. Have you or anyone in your family come into close contact within 6 feet with someone who has a suspected or confirmed diagnosis in the past 14 days, either at home or on a job site? Have you had a fever or symptoms of lower respiratory illness? And on this one, people who want to work may not be honest. And I would encourage them, I'd say, look, even if you're just getting the good old-fashioned flu or a cold, you can't really tell the difference, but even if that's what you have, this is a wrong time to be getting your coworkers sick with a normal flu or cold and getting their resistance beat down such that, maybe they're more vulnerable. And these are, at that point, medical questions, but they are consistent with business necessity. And if you go onto the EEOC site, you'll see, I don't believe they pulled it, the original 2008 or 2009 guidelines for responding to a pandemic. And it explained you couldn't just go off with no analysis and good reason to do medical exams, take temperatures, ask certain medical related things without it being consistent with business necessity. Well, in it, it said the position of the EEOC will change the more serious things become. And oh, by the way, we're very much following public health guidance. Well, recently the EEOC issued a somewhat revised version saying we're still following this, but in fact, we are following the public health guidance and the severity of this virus is increasing. So basically, it is very easy to show the consistent with business necessity for reasonable inquiries, always reasonable. I mean, you start asking about sexually transmitted diseases, mental health issues, and unrelated things, you're clearly going to violate the law. But asking these targeted questions is appropriate. And other screening and evaluation of workers before they enter a project may be useful. I want to talk briefly about temperatures, and then I actually have a question for other panelists. When it comes to taking temperatures, we got this inquiry 4 or 5 weeks ago. We discouraged it because at that point, they were just coming to realize that you could be infectious while asymptomatic. And until then, following restrictions on travel had seemed okay. Well, as the situation has worsened, all of a sudden, there's a general movement among lawyers, and I suspect the government, to accept that this is probably going to satisfy, in almost all cases, being consistent with business necessity to take temperatures. Now, there are quite a few caveats on this, and the first one is you may not have a temperature and still be infectious. It's not a silver bullet, but as we were talking, if you catch one person who's about to come on work and infect others, I think it's justified itself. Also, we've gotten some reports on calibration issues with some of the devices used, as well as in everything these days, difficulty in finding them. If in fact they are used, you still want to follow ADA and related guidance on confidential information. You don't need to keep a record of these. You don't need to seek other unrelated information. You need to apply them consistently to everybody, not just, pick and choose who you do it to. And to the extent possible, you've got to protect privacy. It is not a great idea to line everybody up like, in Hogan's Heroes out in the exercise yard and go from person to person as they face you, taking their temperature. On the other hand, I would very much like to avoid taking each employee into a small airless room for privacy and thus markedly increasing the risk the person taking the temperature gets infected. So we just have to do the best we can in terms of protecting their privacy while doing it. Honestly, my biggest concern is protecting those individuals taking temperatures. Obviously, make it as non-invasive as possible. Early on, people were using the radar gun-like devices, which I think typically you can be about 18 inches away, maybe more, to take a person's temperature. I understand those are right difficult to find. And again, you do have calibration issues. But even using those, you would need masks, you would need gloves. And frankly, in the event the person coughed or sneezed, you really make an argument they ought to have a shield, face shield. Because in getting guidance for employees who are taking temperature, we have to really look at both the CDC and other public health guidance for healthcare workers. Now, most employers I've talked to on this issue have had plant nurses, site nurses, EMTs on site. And in fact, I'm aware of a number of employers that are hiring such people in part to help with doing this sort of screening and temperature taking, and they are to follow healthcare guidance. So our feeling on this issue has changed. It's not a silver bullet, but it can, in most cases, be legally done. I want to pause for just a moment and ask the other panelists any ideas they might want to reference or things they have found useful in screening, evaluating, and trying to keep the person from coming on site in the first place. Guys, any observations?
This is Dale Willis.
Go ahead.
I think it's very consistent with kind of what we found the peer practices were being in, even from last week. We had a fair amount of job site questionnaires. Roughly about 40% were using job site questionnaires from last week, and about 20% were using of the folks that answered our questionnaire were using temperature checks. From our peer groups, there were some unique ways that I didn't even think of that came up using temperature strips that are self-applied. For those that self-identify is one example that they're not feeling well. Things of that nature were some ideas that were brought up that I'm learning as much as anybody throughout this process. So it's been good.
and for those of you who don't already know this, Dale's going to be talking about a survey Willis did. They got a shockingly high number of responses given how busy everybody is, which gives you an idea of, at least at the time of the survey, what peers were doing. And he'll be talking quite a bit more about that. Likewise, I'm sure Rocky with Faith is going to be talking about some of the challenges they're faced on this, given that they aren't necessarily going to be the GC, maybe working on a customer side, et cetera. And obviously, Bill is going to have more observations too. Handling suspected or confirmed cases of COVID-19. The current approach is better safe than sorry. And once again, if the condition is found to be a disability condition under the ADA or state equivalents, or someone brings a claim saying they were wrongly presumed to have a disability condition under the ADA, the requirement is still that even then that we do an individualized analysis, consider whether there's a direct threat posed, and take action accordingly. Well, one of the few things that so far is consistent is the 14-day period of incubation. And I really hope that holds true continues to. And most people still seem to be showing symptoms at 5 days, but they're planning they don't show them until 14. So if in fact you have someone who is suspected of it, it is appropriate to query them and ask them about it. And it depends upon, the information you got. If somebody comes up to you and says, Howard's been hacking and coughing a lot, I wonder if he's got COVID-19. Normally I would say, don't worry about that, but it would not be inappropriate just to ask someone, you're coughing a lot, you got a lot of sinus issues. We realize that isn't always a symptom of COVID, but, these days, just want to check in with you. And that's probably not inappropriate. If somebody comes up and says, hey, did you hear that Howard's wife has been hospitalized or tested positive for COVID-19? I mean, none of us like to act on third-party reports, but if it seems credible, you're probably going to need to approach Howard and ask. And again, limit the inquiry to this issue of the virus. But if someone reports they are living with someone who tested positive or has it, I mean, you have little choice but to keep them out, for at least 14 days from their exposure, which unfortunately might be a rolling thing. If, they're living with someone who has it, when does the 14 days start? Most situations where there's a possibility, people are exercising caution and they are sending folks home. Now, we've got a bullet point down there a little further, though, about what do we do on recommendations and such. Early on, the health guidance and practical approach by most employers, when they learned that they had an employee who had tested positive, developed the virus, or had been exposed, they would alert employees. The one cardinal rule is not by name. Now, the reality is gossip is much faster than email. And you as the manager are probably the last person to know this fact about them. But nonetheless, we aren't going to identify them by name. A lot of times they're already telling everybody. But be that as it may, we're not going to do that. So when it started, it was sort of like, okay, we've just learned there was an employee who was working in the accounting department on the 4th floor on the following days. If you develop, watch yourself. If you develop any symptoms, go see a medical provider. And that was initially the general response, and it's still generally the response of alerting people. There's not really anything they do, and at this point, every day they're at a grocery store or anything else, they may be exposed, but that's still generally considered a good practice to do. Now, the harder question is when and how to determine if, in fact, you need to send large numbers of people home who may have been exposed to this person. And that is going to be risk weighing. That's going to be a case-by-case issue and not really a legal issue as much as a medical and a practical issue. I know a number of hospitals have had someone come in who subsequently developed the disease, and the hospitals did what they should. They immediately yanked a person with symptoms out of the waiting room, took him back in the back, put him in an observation room. And once the person developed the disease, they suddenly realized that they might have to send home to self-quarantine literally 100 employees, ranging from people who checked them in, to push the gurney, to doing the radiology work. Well, that's one of the reasons we're so worried about hospitals. When you start having hospitals have to send home 100 people at a time, you can easily see how that's going to just not destroy, but hamstring our healthcare system's response. And we have to weigh those out in other work environments too, as it becomes more and more common for someone maybe to have been exposed. Well, then we get to the multi-employer site issue. Do we have to notify other employers on site if we had an employee who has tested positive, become sick, or was exposed to a person with the virus? If you look carefully, you'll find out that CDC, most state public health guidance recommends, but doesn't say thou shalt. And so there is a question of whether to do it or not. I think generally speaking, it is still appropriate in keeping with the guidance, the thrust of the guidance at least, and good business. Because if one of the subs or one of the crafts on your job had this occur, I think you'd want to know. As more and more people get it, it doesn't really change anything because everybody has to be alert that they could get it on a daily basis. But that's still the general approach. And then you get into the question, which is not as relevant to us, but what about customers and the public? That's, at that point, it may be too attenuated, but this is as much practical as legal area. And again, the harder part is then deciding, okay, we know a person was at a party with someone who has subsequently tested positive, and then they came to work. Do we send everyone who might have been around them home for 14 days? Again, that's a practical, not a legal issue. As to the return to work policies and procedures, I generally find no legal problem with requiring people who have been exposed, sick, whatever the situation is, to obtain medical release. Problem being that, well, first of all, if somebody gets it, it's taken a long time to get over it, but eventually they will. And there's still open question about whether people can get it again, whether it can go dormant, come back, a lot of challenges. We don't see much legal problem in requiring some sort of medical release. The practical issue is good luck. Except where they're under active treatment by somebody, they're unlikely to be able to get in to see a physician for an evaluation. And as you know, we're still struggling to have adequate tests available, and those are rationed or triaged. So your practical problem is that the person may be unable to get any sort of medical release or a test. I dearly hope as tests become more readily available, we can begin to use that as a way of determining whether to bring someone back, when to bring someone back, and so forth. But just be aware that while you have substantial legal rights in this area, there are a lot of practical issues here to deal with. Other legal issues not necessarily listed here, but which I do want to address. You'll notice that in CDC, in OSHA's guides, there's a lot of emphasis on having a pandemic plan or a disaster plan treating these issues, or an infectious disease plan. Whether it's going to be standalone or bringing together existing Plans, I don't know, but there does need to be a plan of how you're going to approach the situations here. And I am less worried about boilerplate than I am of setting out the basic categories we see in both the OSHA materials and the guidance the CDC gives. And the ones that I've been working on, we've made them very practical. And even if it is called a disaster plan, sometimes we've taken our existing disaster plans that focus principally on hurricanes, tornadoes, floods, that kind of thing. And there have been procedures in place, and we've just brutally reviewed to see if they apply. Because a lot of times they don't. I mean, they were there, they looked nice, but they've never been followed. And sometimes scrapped and just made a short practical document. Other times it was appropriate to add a section. But to me, where the rubber hits the road is going to be doing your site safety analysis on this. And with our love of acronyms, I don't know, are we going to start calling this a pandemic site safety analysis, PSSA, or a COVID-19 site safety analysis? This isn't an express legal requirement, but it is useful to have sort of a practical short document of the basic steps you're taking, rules you're following, again, to relate back to when you are defending your individual actions. And as to other legal exposure, and this particularly comes when you have employees concerned about continuing to work or who get sick and claim they got it while working for you. If there are employees, we're still looking at a scenario of the workers' comp exclusivity rule. And in every state, it is some variation of a standard of you'd have to be shown to have taken almost intentional level action to have warranted getting around workers' comp. I'm going to shut up, and I'm going to hand off to the next presenter because I have said enough legal. I want to hear practical. And I'm trying to advance.
Well, thank you, Howard. Wanted to take you through a couple bullet points of what we did at Donley's, more from the structure of how we got going, from the initial planning to the communications to what we're continuing to look at next. Our initial conversation was just a quick question from our executive team and our third-party medical manager of what are we doing? What are we hearing in the industry? And we partnered with our third-party medical manager to get the medical side from what he was hearing early on. And once we had our conversation with them, we decided that it would be best to put out a communication about increasing hand washing, just some general notices from the CDC that we were seeing popping up, and that we were just allow our employees to know that we're actively monitoring the situation as we were going. Once we distributed that as a toolbox talk, we knew we were in go mode. So we had to start assembling a team to continue to work through this, to make protocol changes and things like that. And we established a team of 5 of us to start. It was our COO, our HR director, our general counsel and risk manager, our safety manager, and a marketing and communications director. And we started to meet. We developed the next steps going through, and we made the immediate decision to start the process of going to a remote working environment for all of our offices and as many of our field personnel and field project teams as we could. We knew that our projects had to remain open. We knew that we needed to leave our offices open to essential duties if need be. And then we made the decision to stop non-essential travel. Once we made that decision, we knew that the 5 of us were not going to be able to handle this by ourselves, so we immediately expanded it to all of our executives and our functional leaders. And there's approximately 15 of us that are on our COVID task force. We meet every other day on the conference call, and specifically we're doing that to look at a couple of different things. What's taking place in our different offices, specific updates from CDC, local health departments, OSHA, as well as any workforce challenges, project status changes from owners or clients or other CMs that we work for from our self-perform division. We're also checking in to make sure that our IT, our cybersecurity and things like that are still working well. And it's also part of our developing our communications to all of our stakeholders. In addition to those 15, there's 3 points of main contact. Our safety manager, our HR director, and our risk manager. We are the 3 main points of contact. We're the ones that are ensuring that we're tracking things appropriately, tracking those that may be coming down with the virus or showing symptoms to make sure that they're understanding what we're requiring of them. And we meet at least daily just to communicate and to make sure we're speaking with a consistent message. And the last thing there that I put that our COVID team is developing communications with all stakeholders. We made sure that communication was on the top of our list. We wanted our employees to be notified. We didn't want them to be in the field with asking questions. So we really took a hard look at our communications. And as a CMGC, we have a lot of different audiences. We wanted to speak with one voice. We wanted to speak with a consistent message. One of the documents that we came across from the CDC is called the Crisis and Emergency Risk Communication in an Infectious Disease Outbreak. And it calls out 6 specific items to remember when you're creating communications. And I just listed the 6 here. It's be first, be right, be credible, express empathy, promote action, and show respect. And that's the approach that we took with all of our communications. And one of them that we started immediately was a daily email. And it discussed our COVID response as a company. It gave us a platform to give up real-time information. The communication goes to all of our employees. It also includes different aspects of the business, whether it's a project win or things to do while you're working from home or remotely, ideas to help your kids through some of the school that they're dealing with. And that was that's our attempt, and it seems to be working to help keep our remote workforce tied together. It's a lot easier to communicate when you're in an office setting and you feel like you're part of the team, but when you're remotely, we wanted to do something to tie them back so that they knew what was still going on in the company. And as I mentioned, we have a lot of different audiences, and the subcontractor and our owner clients began to ask us questions as to what our protocols were going to be, how we were handling the issue. And we had to take a very much project by project approach. We took this approach because of location, the schedules of the job, the different types of projects we were working on, whether it was in a hospital or a nursing home, on a public university, or it was for a general business in town. But throughout that, we wanted to keep a consistent message, and that was what our main driver was, keeping a consistent message, even when we crossed state lines, dealing with different CDC recommendations and different health departments, making sure that Donnelly's was communicating with a consistent message across the board. All of our training documents, we look at everything that we've put out as a version of training. So we made sure that everybody gets that information. We've based all of our toolbox talks off of the most up-to-date CDC recommendations, as well as state and local health departments based on counties and states that we work in. Some of the things that we've rolled out to our self-perform division as well as our subcontractors, we immediately increased the number of hand washing stations we had on our jobs, increased hand sanitizer on our jobs. We've also increased the cleaning of the toilet facilities on the job as well. We moved our morning huddles and our stretch and flex down to the smallest crew possible, so keeping the number below 10 as much as possible to be mindful of the social distancing. We've also, in our STA and our pre-task plan policy, we still use paper for a lot of that. We've asked that they don't sign each of that every day so they're not contaminating pens and papers and passing it along from each other, but just asking the foreman to document who was there. Our big push, as Howard had mentioned earlier about thermometers, we have moved to a self-monitoring, having the individuals monitor before they come to work. We've had pretty good success with this. We do operate it on the honor system, but we know that people are more apt to utilize their own thermometer versus coming to work and having to see that, oh, I have to maybe share that. We have one job that we are currently working at a hospital where the hospital employees, they have 3 or 4 entrances in, and our workforce is monitored by the hospital before they're entered, even allowed to enter into the hospital. We're also working to help define proper procedures on a case-by-case basis for social distancing when our workforce has to work in close proximity because of the tasks they're doing. There are specific tasks in construction it's hard to get around not having two people within more than 6 feet. So we're looking at those as case-by-case situations, and how we can help our subcontractors work through that. We've also moved to a 4-day work week for 10-hour days on projects that we could, working with the owners and our clients, as well as subcontractors, to make that change as easy as possible. Some of the things that we're looking at next, one of our steps moving forward is to continue to provide clear and quick and precise information to all of our stakeholders. We're drinking from a fire hose each day, but making sure that we pull out what we need to institute for our workforces. Continue just to update our current policies, putting together an FAQ sheet that boils down all the communications that have gone out into one document so that people have it as a reference. We're continuing to partner with our functional leaders in the company. We seem to be adding a few more here and there as we go that we might have forgotten in the beginning, or need to get more granular in our every other day call. And also just continue to learn from the CDC, but not only just from them, but working with our hospitals, the clients that we work with, partnering with them to learn what we can do better, how we can help. We've also had, specifically with our hospitals, we've had the infection control risk nurses that are in charge of that come and talk to our folks about how safe they are on the job, how the ICRA is working to help us on the job. So just some different ideas that we had there. I'm going to let Rocky take it over now as coming from the subcontractor side.
All right, thanks, Bill. And you know, a lot of the information that Bill talked about before is very similar to what we're doing at Faith. But one thing before I get going is something that we all need to use. You know, we have close to 2,000 individuals listening to this call, and you know, millions of workers out there. Is with all this going on around us, we can't lose focus on the day-to-day safety. You know, like we talked about opening in this, you know, safety is the most important part of our businesses. And, you know, we have individuals that are worrying about, you know, who's working around them. You know, is their jobs going to, you know, continue to go? Or are they going to get shut down? You know, those are all things that pop into these folks' heads every day that could take their focus off of what they're doing and create, you know, other workplace injuries out there. And that's something we need to continue to push each day. From a Faith standpoint, you know, we started this, you know, the first week of March from a, you know, COVID-19 standpoint, but every one of our employees have a Faith Technologies email, and we have a safety component that goes out every day at 4 o'clock. And like Bill mentioned, it's that daily communication. So we're using that right now as our updates for all of our employees. And again, you know, just like Howard said before, this is constantly changing. So whether it's, you know, travel guidelines that CDC puts out, or, you know, local or county health departments, that's information that we push out to all our employees through that portal. We also created a portal site on our webpage with all, you know, most frequently asked questions. You know, we have 3,000 plus employees out there, and they have a ton of questions. So we put a frequently asked questions page together to help our employees go out there and, you know, see if there's a question that's already been asked. So we're trying to communicate, you know, the best we can in this changing environment with all of our employees. So right off the bat, we push really hard on our business travel, you know, stopping all airline travel. You know, we still do anything that we can, you know, via, you know, driving, you know, a reasonable distance to jobs, you know, because the work is not stopping. But, you know, we shut down all our business travel. We put out what our self-quarantining requirements are for employees. You know, spring break was going on in a lot of our locations. We had individuals that were traveling, you know, both international and to other states, and, you know, what that meant to them when they came back. You know, what our customer and clients guidelines are. You know, they're changing every day. They're learning what this is right along with the rest of us. So, you know, what are we communicating to the clients? What are they communicating back to us? You know, we've had to put together, you know, infectious response plans and, you demobilization plans and things that we've, haven't had in the past, we're providing that to them and vice versa. So, that's something that we look at every day. We also have a task force that meets every day at 2 o'clock to go over any changing items that's happened, since the previous day. And a lot of that is really driven right now through, what job sites are, changing their policy and procedures, whether it's visitors, whether it's workers traveling from out of state. So these are things that we're constantly at. We pushed hard at the beginning of this and still do. The CDC has an exposure risk assessment out on their website, so we can push our employees to that to really help them self-assess, what their risks are related to this. And then the travel advisories, is something that, again, is constantly changing. We have work from coast to coast. What does that look like for our travel employees? So these are some things that I won't get too much in depth because we already spoke on a lot of that, but those are some things that we communicated out immediately from a travel reminder and consideration standpoint. Again, like everybody's seen on the news and online, is the precautions that we've been pushing out to our employees. The social distancing, the washing your hands, making sure the surfaces are wiped down, how to limit your physical contact in the work that we do. And these are things that we consistently push out from an illness standpoint. Putting plans together on how we are going to communicate to our workforce, our job sites, the facilities, if there is somebody that has tested positive for this. Knock on wood, we have not had anybody yet that has tested positive to this virus, but we're putting as many precautions in place as we can. The essential business functions, we've sent all of our office employees that are working remotely from home. So again, that brings in a lot of, IT situations. Do we have enough remote licenses? That's so part of our task force is our IT and business technology group to make sure that we're still able to provide our employees, everything they need to be able to work from, remotely versus the office. Work from home policy, what does that look like? That was something that we had a small policy related to that, but we really had to dig into that a little deeper to make sure everything was getting done and that we can continue to move our business forward. And then, coming up with, an emergency temporary leave and benefits policy. I know the FMLA, the emergency FMLA is out there now, but, having these things in place, it's very important to really curb the anxiety and the potential panic for the employees out there that, now their kids are in at school. How are they going to, be able to have somebody at home and still be able to provide to their family? These are a lot of things that are weighing on people. And we've just tried to communicate out the best we can and keep everybody busy. And, again, this is something that's constantly changing. We're all learning, and I'm glad that, AGC has given us an opportunity to get on these webinars like this to where we can all learn from some of the best practices that are out there. But Kevin, I believe that's pretty much everything that I had for today.
Yes, sir. Until questions.
Good afternoon. Good afternoon. This is Dale Doge with Willis Towers Watson. I just wanted to take a little bit of your time. It seems like a week ago is a month now for most of us, in our minds anyway. But a week ago, Willis Towers Watson, with kind of heard the common theme from our customers that during these times, the safety and risk leaders need more than ever to understand what their peers were doing. So we took the approach to go out with a survey that we looked at common peer practices and resources. Our goal was and purpose was to go out and put something together really quick that would do that. So on Wednesday of last week, we used basically a group of what we call our customer peer leadership group to define a few categories and put together what we call a peer practice survey. And historically, we've always done best practice surveys and methodologies with peer groups on everything from, fleet safety to leading indicators, et cetera. But this was a little bit different. We took the approach that we wanted to have real-time feedback. So as individuals would take the survey, they would get back the real-time results as they click the last button, done. So we put that in place. They also had the ability to write in comments on their peer practices, and that's where we actually learned an awful lot on what people were doing and what companies were doing. And we wanted to basically have direct sharing and develop any or point them to tools and resources. So within 24 hours, we had over 150 customers respond. And I just want to take a few minutes here today and go through those responses. And mind you that these are from a week ago, and a lot has changed from a week. So I just wanted to go through briefly, and I'll try to be brief for the sake of time. I know we're running a little bit later, and I want to make sure that we have time for questions. So it was very diverse. We looked at all parts of the country, national contractors, as well as different demographics as far as size of contractors as well. So it was a very diverse response that we got within that 150 in a 24-hour period. And again, they could, as they'd answer the survey, this would kind of grow and evolve. And I just wanted to go through some of the results. One of the areas we thought was important is to understand how are people navigating through the social distancing in construction. And so throughout the survey, we looked at about 50% were using the type of shift work. About 50%, a little over 50% were staggering breaks and lunches. The separate project offices was surprisingly, even a week ago, something that was fairly common. So meaning, instead of having, if somebody were to come down with COVID-19 in a project office and quarantined the whole project team, they separated people into different project offices. This is more common for our larger projects. Obviously, on a smaller project, there may only be one trailer, but if they could, they tried to separate those groups so they would be able to keep the continuity of the project going if somebody had to quarantine. Obviously, the remote work for those that could in the organization was quite large, and then project basically kind of isolating certain parts of the project to keep that social distancing going. I'm going to go through the next slide as well. Then I'm going to talk about just a couple of things that were more writing comments that I thought were quite interesting, and for the most part, I think has taken off in a lot of the information I've seen. As far as leading the folks to a less than 10 persons at the time, the shift work again was a large opportunity. The use of technology and actually prefabricating, became more popular. So they do it in smaller areas on parts of the project and have it, things brought into the project, which I thought was another interesting, creative way to do things. Some of the other things kind of that has been mentioned already is the morning stretch or toolbox type talks, moving it to a smaller level or crew level, eliminating the break areas and lunch areas, the common breaks and lunch at the same time, or eliminating them altogether, and eliminating most of the community type things where the water dispensers, microwaves, coffee pots, instead of going to bottled water or individual type sources of that were other common themes. The other theme that we realized is entrance to projects, and some of the larger ones that had everything from turnstiles to other more central locations where people would congregate. The efforts made to begin to have more openings and opportunities, more entrances for people to get into, so it spread people out a little bit. Looking at job site screening, again, this is a week-old information, but with the questionnaire, which I believe this is probably the question that changed the most from now to then. But I think the questionnaire was used 37%. Fever temperature checks was 20%. Also, the travel questionnaire, I think, is a similar. If people were traveling from areas that were more prone to infection, and no screening was about 50% a week ago. So I thought that was some good information. As far as providing additional hygiene areas or things on site, obviously hand sanitizer, which is getting more and more scarce, but that was a very popular choice for our respondents. More hand washing stations, third-party cleaners to come in, and the high touch sanitation. So any areas that would have high touch, they would be cleaned more frequently going forward. There was a few, I guess we call more technology advanced things like UV sanitation, fog type systems. There were starting to be looked at. I would imagine some of that is being researched as well right now. The education of the workforce, most at the time were using CDC information, which was obviously a good source, and I think is a great source today as well. They're using their toolbox type talks. They also were using AGC information, and about half people were trying to use their pre-task plans and JHAs to educate folks as well. The basically having anybody with that from last week that had on-site individuals basically test positive. There was about 5% last week from the group that took this particular survey. There was, work comp claim, again, very minor, OSHA recordability, very minor. So last week it was, the biggest impact was the quarantine folks. Is that changing? Obviously this data is from last week, but I imagine that, yes, that's changing. And availability of PPE, N95s obviously is a challenge. And I'm sure this again has changed over time. And for the sake of time, I'm just going to kind of move through the last couple things. The use and value of the information you're getting. I think the interesting nugget we got to hear is it wasn't as construction specific last week. And I think that is changing. The more the AGC puts out in other organizations, I think that's changing drastically. And also the other, having multiple languages. And we, again, try to assist in that as well with some of the resources that we provided with our survey results back to our customers. This last question here is, are you prepared to suspend work? We put a lot of effort into having projects shut down, examples and things to consider for project shutdown. And within our peer groups, because we're having regular customer peer groups right now on this particular topic, it seems the evolution is changing to now the goal of having, how do we keep projects going? And if we do get positive tests, what is the protocols and processes to doing that? So I know more and more information is being fabricated in that area as well. And again, we'll be happy to share either AGC website or the Willis Towers Watson website under the COVID-19. You can find the survey and some of the more write-in comments and details to that. But for the sake of time, I know I went through it quite fast. I just wanted to keep us so we could answer any questions that come up.
Thanks, Dale. And yes, we do have some questions. I got one for you, Howard, and I'll start with it. We talk about temperature taking. Does that constitute medical record, and would an individual be required to maintain that for 30 years as they would with any other medical record?
We discourage keeping any record of the temperature. View it as a search and dispose of for various reasons involving a host of laws affecting medical records. Take the temperature, don't write it down. If they're under it, move them on. And just also for privacy reasons, do not retain the temperature or the name.
Thank you, Howard. This one is for, I would say, Rocky and Bill, if applicable. Shared vehicles and/or hotels. Some companies, have workers working, out of state, away from home, and they house them, or you could, even if it is a local project, you provide transportation. Have you guys implemented any plans or policies, procedures to address this type of scenario?
As far as the vehicle sharing, we've just provided our teams with extra disinfectant. We have one of the guys that volunteers to do it. He's responsible for the vehicle. So He just cleans the vehicle, and that's really about the extent that we've been able to control that.
Yeah, I would say we have shared vehicles that often. We have a couple of, site vehicles that are out there, very similar to what Bill said, the extra cleaning that happens. And in the hotel, Kevin, we really haven't ran into that. We, all our individuals that are traveling, they are, on their own from a, travel standpoint on a per diem section. So we're not really, haven't got into that from a shared, hotel room standpoint. But definitely something that we'll great. It's a great question. We'll definitely bring that up and have that part of our discussion from a, a communication piece, but we have not put anything in place yet.
Okay, thank you. Well, Rocky, someone wanted to get a copy of your work at home policy. I don't know if you can share that, but if you could, we could try to make that available to them. Another question, with all these changes, and again, it's more of the, practical implementation of it. And again, for our contractor members or even maybe you, Dale, from speaking to some of your clients, what's the biggest challenges that you had to face, Rocky and or Bill, and Dale, what are some of the biggest challenges that you've heard from your clients? I'll start with you, Dale.
I think it's kind of just how fast this is evolving. Obviously, I think certainly that's part of it. And I think what the biggest challenge right now is as this does evolve, and you start having potentially infected individuals on your project. What is the protocol? I mean, is it what is the from a disinfecting the area from the people they came in contact with? Those I think are the challenges. I'm not sure we have a great answer for it yet. I think it needs to be keeping people somewhat in smaller groups from the socialized, from social distancing, I think helps, so you can isolate that part of the project. And then from what I understand, it seems like from the CDC that things don't last more than 3 days. So on surfaces, that's what I'm hearing. So I would think after a few days, certainly those areas and some decontamination, you'll be going back to work. But those are the challenges that we're hearing.
Okay. Rocky?
Yeah, I would say the biggest challenge from us is similar to, what Dale said. It's just, the uncertainty of the projects that we're working on. Are they going to continue a regular schedule? Are they adjusting hours? Are they moving shifts around? Is being able to stay ahead of that so we can communicate back to our employees, again, because it is changing. A lot of our food service stuff, it shut down, very quickly. So, being able to communicate to our employees in a timely manner to get them where they need to go to keep them working. I would say that's the biggest challenge, is just being able to deal with the constant changing with our customers and clients based on the new information that's out there.
Anything you might want to add, Bill?
One of the things that we've had to really focus on as a challenge is communicating with a multilingual and multicultural workforce, and just making sure that what we provide to our native English speakers is able to be distributed amongst all of our workforce. And along with that is then balancing the optic that all of our office folks are able to work from home, but our project teams aren't, and just balancing that optic and trying to, just relay, the many thanks that they are on the front lines continuing to work, but also trying to just support them as well.
Okay. Thank you. We have a question maybe for you, Howard, here. And one of our participants said that they've heard reports or been told directly that Cal OSHA would not be focusing on this. Have you heard that from the federal folks or any other state plan?
I don't believe in most cases there is a formal pronouncement. not surprisingly, your average compliance officer, IH, area director, district manager is reluctant to put their people in harm's way where it is not truly necessary. There are issues that I think OSHA, whether they've said it or not, could reasonably say they really fall more in the purview and expertise of departments of public health. I think that is going to translate to an emphasis on written complaint response process. Interestingly, a few states seem, and I've been a little surprised at this, to be very aggressively proceeding with other cases and doing excessive on-site interviews. I might often think they're excessive, but live with it in the management of an OSHA case, but have been perplexed in this case. But I mean, other state plans are really pulling their horns back. I'll check and see if in the last day there's been some formal pronouncements from Cal OSHA, but generally speaking, I've not seen these flying about.
Okay. Question for both Rocky and Bill. Have any owners decided to shut down their projects, and not by way of any state or local ordinance, just voluntarily?
Yeah, we've had several that had shut down or discontinued work for the time being in multiple states, and that was done on their own. Again, like I said, a lot of the food manufacturing facilities, they were kind of one of the first ones to start closing up the construction side of their business.
Yes, we've had working at one of the local hospitals here in Cleveland. They shut us down almost immediately. They've really been the only ones that have shut any of our work down. Everything else is still going.
Okay, Howard, here's another one for you. On the issue of taking temperatures, you mentioned, if they're below, just keep it moving, don't even record. Someone has a question here. What is the opinion of having a worker self-complete a questionnaire and hand it in?
Well, the only problem I have with the self-completion of the questionnaire is going back to what one of the other panelists said, I believe, can't remember if it's Dale or Rocky, that they're trying to eliminate as much as possible occasions of handling paper. And obviously that is one more occasion of it. We get into the literacy issues and the ability to read, write, so forth. Oddly enough, this is contrary to what you'd normally hear from me. I think I would prefer to see it done by questions, but I realize that involves closer contact and it involves having more trouble keeping it private. So as I walk through this, I guess it would mitigate in favor of doing it that way, but I would immediately dispose of those afterwards, lest you want to have to determine how to retain them under ADA, various state laws, and so forth. So yes, I'm okay with that. Expect to still have situations where people can't fill it out, and be careful about still the interaction, and then finally do not retain but destroy in a secure way any of that info you gather, because I can't really see reason to keep it. Maybe somebody would say, well, if a week from now somebody announces they're sick and we believe they've had symptoms, maybe we could take action. I just don't think that outweighs the legal hassle of retaining the info.
Got it. Thank you, Howard. We're well over our time. And for those who have submitted questions, we will get a printout of them. Your name is attached as asker. We'll do our best to try to follow up with you one-on-one, and maybe we could, develop a AGC webinar FAQs document from all the questions we were not able to get to over this 8-part series. But I do want to close with this one question, and I think it's, something that, all 4 of you can answer. And it was something that I was going to ask anyhow, but someone asked the question. Basically, their statement is, just overwhelming, just the situation itself. And the information that's been presented today is great, but it all comes from organizations with thousands of employees with vast safety, risk, HR, communication resources. It seems impossible for a small contractor to comply or stay in business. What advice would each of you give to the smaller contractors that are on the call today? I'll start with you, Howard.
Well, one, stay tuned on the various federal pronouncements and determine where you can avail yourself of payroll tax credits, of loans. All that is developing as we speak. And, I just stay on top of that. I know we're putting out educational materials on it, AGC is, and so forth. Second, elaborate isn't necessarily better than simple. And, for example, what Faith and Donnelly is doing is just superb. But if you break it down to a smaller employer, that comes down to developing some basic practices, using common sense to do separation and determine when PPE is needed. These are fairly straightforward questions. And as in any safety issue, have woodshed meetings with supervisors, foremen, lead people that we're damn serious. I mean, just like tying off and so forth, we're going to maintain separation, we're going to use required PPE, et cetera. And I think small businesses can do that. And, thankfully, AGC and others are providing materials they can use.
Thank you, Howard. Any suggestions from you, Bill, for some of our smaller GCs, or even especially contractors that are on the line?
I know in my career in safety, it's never been about hoarding information or it's proprietary. Just partner with the other contractors on your jobs, partner with the local CMs in your town or on your projects, and just create a partnership with them and just work through it. I know we've got some smaller GCs and especially contractors in the area that here in Cleveland that we're working to get them some information and just, making yourself available and just ask the questions.
Rocky, and then we'll end with Dale.
Yeah, I would say from my standpoint, it's the communication, making sure the individuals aren't just out there with the unknown. It can be as simple as, a mass email, a conference call from the owners or CEOs, for the smaller groups. But I think that's really what's helped us, is being able to find different ways to communicate with our folks out there during this uncertain time. So, we all know, that can be a mass text message, it can be something like that. As long as you're keeping them in the know of what's going on, I think really, calms a lot of the people down.
Yeah, I completely agree with Rocky. I think now more than ever is the time where we need to communicate to your workforce and really show them that you care. That goes a long way. And using the resources of AGC and others. The one thing that I've been really impressed throughout this is the level of sharing and collaboration in the industry has been outstanding, and I expect that to continue. So.
Well, thank you again to all of you today for presenting for us. We appreciate your contributions today. I know, as it said many times during the presentation, things could change from today to tomorrow to the next week, and we'll do our best to continue to provide updated information and develop resources, in partnership with our contractor members as well as our chapters, to help everyone kind of navigate through this until things return to normal. And with that, I want to thank everyone for logging on into today's program. The next of ADC's webinar will be held tomorrow on Friday. It's entitled Navigating the Outbreak, Part 5, the Components of a Comprehensive Project Continuity Plan. And again, thank you all, and have a good day.